Hello, I'm Dr. George Ampat. I'm a consultant orthopedic surgeon and work in Liverpool, United Kingdom. Today, I'm going to talk about one of the practical difficulties in providing medical reports following personal injury. The law states that we have to be objective in providing reports. There is no doubt that one has to be objective, and in most cases, there is no issue. The patient has had an injury, a report is provided, and the patient improves following a period of rehabilitation and returns to his or her pre-injury state of health. However, in some cases, it is not that simple. Now, let us look at a scenario where a patient, say Mr. Smith, age 45, injured his back whilst at work. Mr. Smith has now been off work for 2 years and complains of chronic low back pain. He has attempted to engage with physiotherapy, but unfortunately has not made any significant progress. MRI scans have been performed and they just show age-related changes. He is now sent for an expert medical opinion as part of a personal injury claim. For purposes of discussion, let us consider that he sees two different experts, orthopedic surgeon number 1 and orthopedic surgeon number 2. Both the orthopedic surgeons take a thorough history, examine him and review his medical records. Examination reveals that there is stiffness of movement of the lower back and there is tenderness on palpation of the lower back. There is no neurological deficit and the nerves are not affected. Medical records reveal that he has attempted physiotherapy but has not made any significant progress. He is also engaged with the pain team and has been put on various medications. This has also not made any significant difference and he still continues to experience severe pain and he has not returned to work. Orthopedic surgeon number 1, following a thorough history and examination, provides the following report. Mr. Smith has had this pain for a long time now. He has been told that movement is important for managing chronic pain. Unfortunately, even with that advice, he is still not exercising. I am not sure how much more physical therapy can help. Mr. Smith does not seem to understand that without physical activity, his condition is likely to worsen. It's time he takes responsibility for his own health. My conclusion is that the injury would have caused pain for 6 months. The pain beyond the 6-month period is because the claimant has not engaged in exercises and is not related to the accident. This report may seem objective. However, let us look at the impact on the patient. He may feel judged or blamed. The guilt or shame may increase, possibly worsening emotional distress. He could become defensive or withdraw from care. He is also unlikely to engage positively with treatment or exercise. And it is possible that he may not return to work. Now the same patient sees orthopedic surgeon number 2, and this surgeon provides the following report. Mr. Smith has had this pain for a long time now. Living with persistent pain can be incredibly difficult, physically, mentally, and emotionally. It is completely natural for patients to feel hesitant about movement or exercise when discomfort is already such a big part of their day. The experiences that the claimant is facing is valid and the challenges are real. That said, I truly believe in the claimant's capacity to find some relief and improve his quality of life. One of the most effective and evidence-based approaches to managing chronic pain is gentle, consistent movement. This doesn't mean jumping into strenuous activity, but rather starting small. Even a few minutes of light stretching, walking indoors, or guided movement can begin to shift the body and mindset towards healing. It is possible that the therapist he had been engaged with in the past has been very busy and has not been able to provide the time and compassion necessary to inspire and motivate the claimant. It is important that the claimant is now referred to a compassionate therapist who has the time to create a personalized, manageable plan that suits the claimant's pace and comfort level. The goal is not perfection, it's progress, one small step at a time. Even in my short interaction with the claimant, I have found him to be positive and keen to improve himself. He has very clearly stated his intention to return to normality. He now needs to be supported. I have every faith that he will do well. I have also given him some resources from YouTube providing exercises to build up the lower back. I am certain that he would be significantly better in 6 months' time when hopefully a final report can be provided. The report by orthopedic surgeon number 2 is also objective, but in addition, it is optimistic and supportive. Now let us look at the impact on the patient. The patient feels understood and validated. He will become more open to change. It builds trust and motivation to try a small step. It also increases adherence to treatment plan. The report by orthopedic surgeon number 1 emphasized the importance of exercise, but risks alienating the patient through judgment. The report by orthopedic surgeon number 2 acknowledges the emotional and physical burden of chronic pain while empowering the patient to take manageable steps forward. We have an adversarial system. In this system, it is possible that the claimant's solicitors prefers the opinion from the orthopedic surgeon number 2 and are likely to instruct orthopedic surgeon number 2. On the other hand, defense solicitors and insurance companies are likely to instruct orthopedic surgeon number 1. Both reports are objective. However, the second report gives hope and potentially enables the patient to return to his job. Unfortunately, it is possible that report number 1 will alienate the patient and prevent him from ever returning to work. That only increases disability and the associated costs. Let me reconstruct a similar scenario in a family home. Boy A has failed his exam 3 times. The head teacher wants to send him out of school. Boy A takes his report and the letter from his head teacher stating that he does not have a place in the school in the following term due to poor performance. He takes it to his father, Father A. This is the response from Father A. Son, we need to have a serious talk. You failed this exam 3 times now. Your school is losing patience. And honestly, I'm starting to question whether continuing in formal education is the right path for you. Maybe you're just not intelligent. It's time to consider other options, perhaps learning a trade or finding work. We need to be realistic about your future and your capabilities. Let us now look at the impact on the son A. He feels discouraged, possibly ashamed, may internalize failure as personal inadequacy, could lose motivation or confidence in all academic pursuits, might feel unsupported and alone. Now let us look at the interaction between boy B and Father B. Boy B has also failed his exam 3 times. The head teacher wants to send him out of school. Boy B takes his report and the letter from his head teacher stating that he does not have a place in the school in the following term due to poor performance to his father, Father B. This is the response from Father B. Son, I know you're going through a really tough time, and I can only imagine how discouraging it must feel not to pass the exam after trying so hard. But I want you to know I still believe in you. Failing doesn't mean you're a failure. It means you're learning in a different way and on a different timeline. let's figure out what's not working and how we can change your approach. Maybe a different learning method, a different tutor, or even a different school. I am proud of your effort, and I'll be right here as you try again. Let us now look at the impact on son B. He feels supported and safe to keep trying. Maintains self-esteem and hope. More likely to seek solutions, take ownership of his progress. He learns resilience and perseverance. Both attitudes acknowledge the fact that the exam has failed multiple times. But the second approach keeps the door open for growth. It encourages the son to redefine failure, learn from it, and feel empowered to continue. The first approach, while pragmatic, might shut down emotional connection and long-term motivation. It may be very difficult to choose between orthopedic surgeon number 1 and orthopedic surgeon number 2. However, I know which father I want between father A and father B. In all my interactions with my patients, whether it be in my NHS practice, private practice, or in my medical legal practice, I inspire and motivate my patients as much as possible. This brings out the best in them. If we become harsh and judgmental, there is no progress. I do the same to my children. I do that to my students whom I teach. So why should I not do it to my patients? Even this year, I have been shortlisted as the Teacher of the Year by the Liverpool Guild of Students, which is the official students' union for the University of Liverpool. Thank you so much for listening. If you like this video, please like, share, and subscribe. Thank you so much.